Whoa, today I had to do this video because I think I've had enough. Like almost everywhere I go or every patient always say they have typhoid or malaria. I don't know why people just think that anytime they have any form of fever, bone pain, joint pains, runny stomach, constipation, they are vomiting, is typhoid. How is that possible? How is that possible? And the truth is, they then go into self-medication, which is our topic for today. Let's go there. Welcome back. If you're just joining this channel, don't forget to like, share, and comment, and turn on the notification bell so you stay abreast with all our recent uploads. And if you're a returning subscriber, this is me saying, I love you. Shutem. Now, diving back into this class, we are looking at a very interesting topic: self-diagnosis, self-prescription, self-medication. I'm telling you, it is very common around the world. Like I explained earlier, almost everybody that you meet says they have malaria or typhoid. Many people self-medicate. Most people just read off the internet or just believe that they are sick of malaria or typhoid, and they go around buying antibiotics or anti-malaria tablets, which is so wrong. Self-medication, self-diagnosis, self-prescription is very dangerous. It is harmful to our health, guys. Now, I want to go in details why some people may be afraid of going to the hospital to get diagnosed and get tested by a doctor. Why are some people always self-medicating? Why are they always medicating themselves, prescribing drugs for themselves, even when they are not medical professionals? If you're a medical professional, it's okay if you prescribe drug for yourself, but most doctors I know have doctors. So one of the reasons why many people do self-medication is the cost of consultations or the cost of the tests, the diagnostics, the cost of the diagnosis, the tests you do in the lab, the tests, your scans you're going to do, and a lot more. Many people are not able to afford these, so they go into self-prescription or self-medication. Another is fear of the side effects. Many people are afraid of the side effects of the drugs, so they go to the hospitals or to the pharmacies or to the drugstore, corner drugstore, buying drugs that could be similar to the drug that they have taken before. The third point here is they are trying to avoid being tested, being stigmatized by a certain disease. Let me say they are denying the symptoms, denying that they could have this disease or this infection because of the stigma surrounding that disease. And in this case, we're talking about HIV, and there are a lot more. The fear of receiving treatment due to a perceived negative stigma. For example, if you have a certain illness, or if you know that you have this illness, you are going to be going to the clinic for routine checks, for follow-ups, and continuous testing will be done on you. Medications will be prescribed to you. So a lot of people prefer self-medication, where they can pump themselves with different drugs at different times, trying to suppress the symptoms, so they can live in their ideology that they are in good health, or that they can handle their health by themselves. Now, we are going to be looking in details the causes of self-medication. The first is organ failure. When you go buying drugs from the drugstore or from the pharmacy for a certain disease that you think you have, you may end up taking the drug at the wrong dosage or prescribing a drug that was not meant for your weight or for your age, and it may damage your organ. Or you may actually take a drug, buy a drug from the pharmacy, and while taking it, you may have another underlying health condition that may worsen this infection in this organ and cause this organ to shut down completely. Secondly, it may cause premature death. A lot of deaths that you're seeing around, premature deaths you're seeing around, it's not village people. Many people who self-medicate themselves, who go around doing self-medication or self-diagnosis, actually suffer from premature death. That's because they want to be their own doctor, they want to be the microbiologist, they want to be the nurse, they want to be the pharmacist, and at the end of the day, you end up messing up your system, messing up the ecosystem, your body, and you die untimely. The next point on the list is drug resistance. Now, when you start taking a drug and you don't know the right dose you're supposed to take in order to eradicate that bacteria, virus, or protozoa, or whatever for fungi from your system, what happens is, if it's not taken in the right doses, that drug, that bacterium, or that microorganism becomes resistant to the drug. And when a popular drug that's on the market, that has been tested and approved by specific health organizations, have been sent into the market, and you as an individual start developing drug resistance or resistance of that drug, or the bacterium or the microorganism is resisting that drug, you are going to be in a lot of trouble, because it will take some years to come before another improved drug will be released on the market to treat your case. And you will find out that you end up taking drugs for a long period of time, in some cases, taking this drug for a long period of time, and these high doses may cause toxicity in your system. It may harm your liver or your kidney or other organs in your body, and the side effects may be detrimental to your overall health. Drug allergy. That is, you may start having allergic reactions to certain drugs, either rashes on the face, either a swollen mouth, because some people are sensitive or allergic to certain ingredients in certain drugs. For example, some people who are lactose intolerant, they are supposed to be prescribed drugs that are not manufactured with lactose. For another example, are those people who have gastric ulcers, who are sensitive to gastric ulcers or peptic ulcers. They are not supposed to be given non-steroidal anti-inflammatory drugs like paracetamol, ibuprofen, doliprane, ibuprofen. They are supposed to be given other painkillers that are more powerful, but they are not sold on the open market, like tramadol. I know somebody who took a drug of tinimidazole and ciprofloxacin, and she had her mouth swollen. Swollen, because when a drug is prescribed to you, the doctor will actually ask if you're allergic to a particular drug. There are people who are allergic to penicillin, to quinine. So these are things that you don't go around doing, because all these allergies in combine could escalate into something else. The next point is, it may worsen the condition of the disease. It may worsen the disease. It could make the symptoms worse, because you don't actually know what you are doing. Bear in mind that although these drugs were meant to cure us, they also have ingredients, components in them that need to pass out of our body, that if taken wrongly, it could actually worsen our symptoms. Because if you look at the leaflet of many drugs, or in the packaging of many drugs, you realize that they will state that side effects of the drugs. So these are things that you need to take off. Wrong dosage. Wrong dosage. A lot of people, for example, if you look at the malaria drugs, a malaria drug is supposed to be given to you according to your body weight. According to your body weight. Not because it's sold in the pharmacies or in the drugstore, or because it's a good drug, or because you heard that A or B used the drug and it worked for them. These drugs are supposed to be taken according to your body weight. So if you take the drug wrongly or you buy the wrong package, you are making your body resistant to that anti-malaria drug. And the next time when you take it, it may not eradicate the plasmodium in your blood. Drug interaction. There are some drugs, for example, some antifungal drugs, some antibiotics that interact with each other. And when they interact with each other, they are no longer effective. The pharmacodynamics and the pharmacokinetics that's supposed to happen in the body doesn't happen normally because of that drug interaction. And in another case, drug interactions could also happen with alcohol, with coffee, with dairy products. That is why you need to see a doctor before prescribing stuff for yourself, because there are some drugs that you are not supposed to take even a sip of alcohol with. There are some drugs, same with coffee. There are some drugs with dairy products, because antibiotics, for example, do not get absorbed at a good rate, at the normal rate, if dairy products are in the body. Malaria has the same symptoms with yellow fever and pneumonia, and with some respiratory diseases. So you could be thinking that you have malaria, but it's pneumonia or yellow fever. This is why tests need to be done. I know a lot of people will be saying the amount, the cost of the test, but it's worth your health. And the next point is, it actually extends your life. It actually, some of your organs are going to, it actually makes your organs live longer. For example, you don't age quickly. If you notice, people who live on drugs for a long period of time, medications for a long period of time, actually age quicker. And when they get to 60, 70 plus, they are more prone to a lot of diseases. That's because they have messed up their system with a lot of drugs. A lot of drugs that contain ingredients that have been toxic to their bodies. The masking of a severe disease. That means you may have a severe and a chronic disease, and because you are self-medicating, you mask this disease. And in the long run, you may end up losing your life, or that organ, or an organ shuts down or shuts functioning in your body, or you may make it even worse and you will spend even more money. This is why self-medication is widely discouraged by the WHO. In fact, by any health facility that discourages self-medication. You need to see your doctor. Even if you don't have money, go and see a pharmacist, because they understand pharmacodynamics, pharmacokinetics, and they have done a branch of pathogenesis. So they are able to help you, although they'll be doing a spot-on diagnosis. But lab tests are important. Medical diagnoses are very important. The treatments, clinical pathology, clinical diagnosis is really important. What can self-medication lead to? Self-medication can lead to organ failure. It can lead to antibiotic resistance. It can lead to drug resistance. That's the second. The third is it can lead to drug interaction. It can lead to premature death. It may lead to allergy. It may lead to masking a severe disease. I mean, you have a severe disease, but you don't know. Lastly, incorrect dosage. So thank you for joining me in today's class. Till next time, I remain your seasoned and certified medical professional, Gwendolyn Halle. Bye-bye.